Okay, so you're prepping for the NCLEX. You know that maternity and newborn pharmacology can feel like a mountain to climb. Well, today we're going to cut right through all that noise. We're not just going to talk about what these meds do, we're going to focus on exactly how the NCLEX is going to test you so you can walk into that exam feeling totally prepared.
And first off, I've got to give a huge shout out to Dr. Abdulkareem for providing the amazing source material that makes this whole thing possible. He really zeroes in on those NCLEX priorities, and that's exactly what we're going to build on today. All right, let's get to it.
All right, here's our game plan. We're going to start with the absolute essentials, the big picture. Then we'll dive into the meds that relax the uterus, the tocolytics, followed by the ones that stimulate it, the oxytocics. After that, we'll hit some key postpartum and newborn meds, and then we'll wrap it all up with a killer strategy for mastering the questions.
Okay, so to really get a handle on this stuff, you've got to understand one super simple idea. Almost every single medication we're about to talk about falls into one of two groups that do the exact opposite thing. Think of it like a constant push and pull. We're either trying to stop contractions or start them. Once you get that, everything else just clicks into place.
First up, we've got the tocolytics. Their one and only job is to chill out the uterus, to suppress contractions. They're the brakes. We use them to try and stop preterm labor. For the NCLEX, if you remember nothing else, remember this: toco means stop. And then, on the flip side, we have the oxytocics. They're the gas pedal. They do the complete opposite. They fire up the uterus to make contractions stronger, more frequent, and last longer. So for the test, just think oxy means go. Simple as that.
All right, let's dive a little deeper into our toco stop drugs, the tocolytics. These are your heavy hitters when the goal is to halt preterm labor and give that baby a little more time to develop.
Okay, this slide is gold. Seriously, it boils everything down to the one thing the NCLEX really cares about for each drug. For magnesium sulfate, it's all about toxicity. You hear mag sulfate, you think toxicity. For nifedipine, it's hypotension, low blood pressure. And for Betamethasone, it's all about time. You can't use it for more than 48 hours and never after 32 weeks. This is how you need to think.
So let's zoom in on the big one, mag sulfate. This one is everywhere on the NCLEX. So what are those red flags? What are the clues the test is going to drop in the question to tip you off that something's wrong? Okay, these right here, these are your clues. This is what you're looking for in the question. If you see respirations dropping below 12, or those deep tendon reflexes are gone, or the urine output is tanking, your brain should be screaming magnesium toxicity. The NCLEX expects you to see these and know instantly what's going on and what you need to do. So what's the magic number? Well, the sweet spot, the therapeutic range you're shooting for with mag sulfate is between 4 and 7.5. The second you go above 7.5, you are officially in the danger zone. You absolutely have to have that number locked in your brain.
Okay, so you see the signs, you know the levels are high, what's your priority move? You gotta have the antidote. And for magnesium sulfate, that antidote is calcium gluconate. Any safety question on the NCLEX is going to hit this. You have to have it right there, ready to go whenever a patient is on a mag drip. Period.
All right, time to flip the switch. We're moving from stopping labor to starting it. We're now in the world of our oxy-go drugs, the oxytocics. These are what we use to get labor going or to control that really dangerous postpartum bleeding. Now, when we talk about oxytocics, the superstar is obviously oxytocin, right? But what do you do when it works a little too well? If you see signs of uterine hyperstimulation or the baby's heart rate doesn't look good, these are your immediate step-by-step actions. And look, the very first thing on that list, number 1, is stop the infusion. That is almost always the right first answer in a crisis.
Okay, let's try another classic NCLEX-style question. A patient has postpartum hemorrhage and the doctor orders Methylergonovine. What is the absolute number 1 thing you must check before you even think about giving that drug?
It's one thing, just one: blood pressure. And here's why, because you got to know the why. Methylergonovine works by clamping down on blood vessels, which is great for stopping bleeding, but it also means it can cause severe hypertension. So if your patient is already hypertensive, this drug is a huge no-go. It's a critical safety check.
Okay, let's fast forward to right after the baby is born. The delivery is over, and now our whole focus shifts to protecting both mom and the new baby with a handful of really important medications. So this table lays it all out perfectly. These are the big 3 meds pretty much every newborn gets. First up, vitamin K. The NCLEX loves to ask where you give it. It's the vastus lateralis muscle. Next, the Erythromycin eye ointment. The key takeaway here is that you can actually delay giving it for about an hour to let the parents bond. And finally, the Hep B vaccine. The absolute priority, you have to get parental consent first. Each one has a little nursing pearl that's perfect for a test question.
So, we've gone through all the meds, but let's be real. How do you actually use this information when you're staring at a test question and your heart's pounding? This last part is all about giving you a solid, repeatable strategy to get these questions right every single time. This is it. This is your 4-step game plan. Step 1. What's this drug trying to do? Is it a toco stop or an oxy go? Step 2. What's the biggest, scariest thing that can go wrong? Think respiratory depression with mag sulfate. Step 3. What do I absolutely have to check? Think blood pressure for Methylergonovine. And step 4. Is there a reversal? Do I have calcium gluconate on hand?
And you know, this is why this works. It's not about just memorizing a ton of random facts. This framework forces you to think like a nurse. It's about prioritizing safety, it's about connecting the dots, and it's about demonstrating clinical judgment, which is literally what the NCLEX is testing you on.
And there you have it. That's our deep dive. But here's the real takeaway. My challenge to you is this. As you keep studying for the NCLEX, can you take this 4-step framework and apply it to every single drug you come across? Because if you can do that, you're not just memorizing, you're mastering the material.